Living with hemophilia. Many people living with hemophilia, a condition that causes prolonged bleeding due to blood clotting issues, can live almost normal lives. No matter your type, hemophilia A, hemophilia B, hemophilia C, or acquired hemophilia, there are ways to manage it effectively. Staying active, eating well, having proper health insurance, and accessing the right support and resources can help you live well with the disease. How hemophilia affects daily living. How hemophilia affects you depends on your symptoms, the type of hemophilia you have, and whether it's mild, moderate, or severe. The main sign of hemophilia is excessive and prolonged bleeding. Even a small cut or injury can turn into a serious emergency. Other symptoms that can affect daily life include frequent, unexplained nosebleeds, heavy bleeding after any procedure that punctures the skin, such as shots or dental work, joint bleeding, which is more common in severe cases, muscle bleeding, affecting 10% to 20% of people with hemophilia. In some cases, internal bleeding can happen, leading to stomach pain, swelling, or tenderness, chest pain or trouble breathing, blood in the stool, urine, vomit, or when coughing. Certain activities, like intense contact sports, and some medications, such as blood thinners, can also increase the risk of bleeding.